Welcome to Know Your Genes, Understanding Genetic Testing, a joint webinar hosted by Sisters Hope Foundation and sponsored by Vigil Neuroscience. We are pleased you can join us today for this very special event. I am Heidi Edwards, President and founder of Sisters Hope Foundation and Cure ALSP. We are the Global ALSP Foundation. The goal of today's conversation is to support a deeper understanding for community members on the topic of genetic testing, covering the topics of basic ALSP genetics, an overview of the importance of genetic counselors, and the process of genetic testing. Please note, we are providing the Know Your Genes, Understanding Genetic Testing webinar for educational purposes only. For any treatment decisions, please speak to your treating physician. Today's webinar was previously recorded and will be available on the Sisters Hope Foundation website. If there are any questions after the webinar, please direct them to info@sistershopefoundation.org. We have an impressive lineup of speakers that will be sharing their experiences to aid in giving a deeper understanding of genetic testing. First, we will hear from Erin Sullivan, the Executive Director at Sisters Hope Foundation and Cure ALSP. She will be giving a basic overview of the genetic inheritance of the CSF1R mutation. Secondly, we will hear from Jillian O'Toole. Jill is a genetic counseling student at the University of Pennsylvania who is interning with Sisters Hope Foundation. She is also a member of the Young Adult Ambassador Program. She will be sharing the importance of genetic counselors. Next, Ashley Cannon, Clinical Program Manager at Informed DNA's Life Sciences Division. We'll be talking about what to expect from a genetic counseling appointment, the implications of genetic testing, and the possible results and what they mean. Finally, Cynthia Cassandro, Vice President of Patient Advocacy at Vigil Neuroscience, will be talking about ALSP Aware, the sponsored genetic testing program available for the ALSP community. I will now turn the presentation over to Erin Sullivan.
Thank you, Heidi. And thank you for everyone that is joining us today. Before we jump into the topic of genetic testing, I would like to lay the foundation of ALSP genetics. So let's start with some vocabulary that is commonly used when speaking about genetics. First, genotype. A genotype is a unique sequence of DNA that specifically refers to the two genes that an organism has inherited for a particular gene. Humans inherit genes in pairs, one from mom and one from dad. Genes can be either dominant or recessive. We'll talk more about that in a moment. The next vocab word I want to mention is phenotype. A phenotype is an observable trait, and that observable trait is an expression of one or more genes. Phenotypes are things like hair or eye color, blood type, or even signs of a disease. Another common term used when speaking about genetics is variant. Variant is a very general term used for any DNA change. Variations can be benign, as in not causing disease, or variations can be disease-causing, and this is when the term mutation may be used. Sometimes it's hard to know if a variation is benign or disease-causing. There might not be enough evidence to call it either way, and this is when geneticists use the term variant of uncertain significance, or VUS. Some of these might cause disease, but if you have little evidence, it's hard to be certain. Because of this difficulty, the genetics community has decided to move away from the word mutation and instead grade variations according to a scale. This scale is pathogenic variant, likely pathogenic variant, benign, likely benign, uncertain significant, likely pathogenic, or pathogenic. Now let's circle back to two words I mentioned earlier, dominant and recessive. Genes can be either dominant or recessive. Dominant means only one gene is needed for a trait or phenotype to be expressed. Recessive means two genes are needed for a trait or phenotype to be expressed. ALSP is caused by a variant in the CSF1R gene, and this variant is inherited in an autosomal dominant pattern, which means one genetic variant is enough to cause the disease. If a parent has a variant in the CSF1R gene, then each child has a 50% chance of also inheriting that variant and possibly developing ALSP. The only sure way to diagnose ALSP is through genetic testing to confirm if a variant is present in the CSF1R gene. And this is where genetic counselors come in. So I'm going to pass it over to Jillian, who will be sharing about who genetic counselors are and their importance. Jillian?
Yeah, thank you so much, Erin. So if you are concerned that either you or a family member may be impacted by ALSP, or if you have a confirmed family history of ALSP, then one of the next steps would be to book an appointment with a genetic counselor. So for the next portion of this webinar, we'll be discussing genetic counselors, who are they, and why are they important. So to start, who are genetic counselors? They are licensed professionals trained in both medical genetics and counseling. They help patients and families understand their genetic risks and discuss genetic testing options if that's something they're interested in. However, visiting a genetic counselor does not necessarily mean that you have to get genetic testing. They are only there as a resource for you to help you understand your options. And their goal is really to empower you and equip you with the knowledge and the tools necessary for you to make an informed decision about genetic testing on your own, and that feels good for you. And they're also there to answer any questions along the way to help make that decision easier for you. So next, you may be wondering, what can I expect from a genetic counseling session and how are they structured? So first, they always start off with introductions, and the genetic counselor will likely ask you if you have any goals for the appointment or any topic in particular that you would like covered. So many people pursue genetic counseling for a variety of different reasons, whether they have a personal or family history of ALSP, if they're interested in genetic testing options, if they would like to pursue genetic testing. So, right at the beginning is a good opportunity to let the genetic counselor know where you're coming from and if you have any questions related to your own unique situation, so that the genetic counselor is sure to cover those topics throughout the session. And next, family history is a big portion of every session. So if you want to just go back, thank you. So it may be helpful coming into the appointment with some information about your family tree already, such as ages of family members, any pertinent medical history as it relates to neurodevelopmental history, such as age of onset of symptoms, the type of symptoms, if there's any history of genetic testing in your family, or if you have access to any genetic testing reports, that could be very helpful for a genetic counselor. However, we completely understand, and it's okay if you do not have all of this information. It is way more often the case that patients do not know every single detail about their family history than it is the case that people do. However, any piece of information that you do have about your family history and can bring to the session would be beneficial. Um, and the overall goal of taking a family history is to provide a more accurate risk assessment for you and other family members, and to see if genetic testing is something that makes sense for you based on the patterns and the data from the family tree. And after risk assessment, we will discuss all of the genetic testing options if that's something the genetic counselor offers. And then you'll discuss logistics as it relates to sample collection, turnaround time, insurance, as well as any other concerns you may have. And at the end, you can make a plan for testing that feels right for you based off of all of the recommendations and information discussed at the appointment. And so genetic counselors are a great resource, not only for what we just discussed, discussing the pros and cons of genetic testing, as well as all of the logistical concerns as it relates to insurance and testing types of results, but they also understand that genetic testing is no easy decision and it's a very personal one. So therefore, they can also act as a great resource for emotional support in navigating these decisions, and they can connect you to support groups and community resources as well. So in total transparency, not all genetic counselors will be specifically trained in ALSP, and some genetic counselors will have more experience than others. And this is why it is important to do your research before scheduling an appointment with a genetic counselor. And Sisters Hope Foundation has some really excellent resources on their website to help you navigate this process and find a genetic counselor that's right for you. So next, I'll hand it over to Ashley Cannon, and she will discuss more about genetic testing.
Thanks, Jill. So my name is Ashley Cannon, and I have been a genetic counselor for nearly 10 years now. I have specialized in neurologic conditions like ALSP, and I currently work at Informed DNA. We offer genetics services, including telehealth genetic counseling, and I manage the ALSP Aware program that you're going to hear more about later on. So today I'm going to talk to you about genetic testing. Why do some people decide to have genetic testing while others decide not to? What are the different types of results that you can get from genetic testing, and what are those implications for each of those results? So let's start off with some of the reasons why people choose to have genetic testing. There have been several studies now to better understand why people have decided to pursue genetic testing whenever they know that there's a family history of an adult onset neurodegenerative disease without a cure. Most of this research has been done in Huntington's disease, but I do think a lot of the lessons learned and information can be translated to the ALSP community as well. So the first reason why people choose to have genetic testing is to reduce uncertainty. There are some people that just have to know yes or no, are they going to have ALSP? They cannot handle the unknown. They have to know. If that is your personality type, then you may be more likely to pursue genetic testing. Other reasons why people choose to have genetic testing is to enable financial planning. There are definitely planners out there. They want to prepare for whatever is going to happen in the future, whether they're going to have ALSP or not. They want to be prepared for that. Other people have genetic testing for reproductive decision making. So some people need this test result to decide how to expand their family. Maybe that's adoption. Maybe that is having biological children. And a subset of those people may decide to have in vitro fertilization with pre-implantation genetic diagnosis to ensure any future biological children do not have the CSF1R variant that they carry. And in order to do that type of testing, you have to know what variant is in the family. Another reason to choose genetic testing is to provide information for family members. In my experience, most of these people are older, they have lived their life. The genetic test result really isn't that valuable for them, but they feel like it's really valuable information for their other family members. Another reason for genetic testing is for clinical trial eligibility. And this could be for current clinical trials or future clinical trials. Many and more clinical trials require genetic testing to determine eligibility. And then lastly here, some people choose genetic testing in order to connect with support and advocacy groups. Some people just want to be a part of a community that understands what they are going through. All right, so those are the reasons people choose to have genetic testing, but there are also many people who choose not to have genetic testing. And whether you do or don't is perfectly fine. There isn't a right or wrong answer. It's just finding the right one for you. So again, there has been studies to understand why people have not had genetic testing. And the first reason I think is the most common one that I have heard in clinic, and that is genetic testing. It's just not the right time. These people have a lot going on. There may be a major life event, like they are preparing for a wedding, and they want that to be a great experience and just don't want to have to deal with the genetic testing process at that time. Now, this Doesn't mean that they will have genetic testing in the future. It also doesn't mean that they're not going to have genetic testing in the future. It just means they don't want to think about it now. They want to think about that later. Another reason why people choose not to have genetic testing is because they don't have a really good support system in place. We strongly recommend anyone that has genetic testing has a trusted family member or friend to be with them during this process and actually attend appointments with them. And some people may not have that trusted support person at that point in time. Another reason some people don't have genetic testing is because of the psychological impact. Learning that you may have ALSP in the future can be really devastating to some people, and they just can't handle knowing that. They much rather live their life and deal with it if it comes up later on in their life. They just don't want to deal with it now. And again, that is perfectly fine. If you are that type of person, then genetic testing may not be right for you either. Some people choose not to have genetic testing because they're concerned about genetic discrimination. And I want to talk a little bit more about this on the next slide. There is a federal law that was passed several years ago now called the Genetic Information Non-Discrimination Act, or GINA for short. This law protects Americans from discrimination based on their genetic information in both health insurance and employment. So what does this mean? It means that your health insurance cannot drop you if they learn about your genetic information. This also means your employer can't fire you if they learn about your genetic information. But importantly, there are some exceptions. GINA does not apply to long-term care insurance, life insurance, or disability insurance. So we very strongly recommend anyone who is considering genetic testing to look at these policies to see if this might be a good option for them. Because whenever you fill out the forms to see if you can get this insurance, oftentimes there's going to be a question about whether you have a known genetic condition. And if you are filling out these forms before you've had testing, you can honestly answer no, that you are not aware of any genetic conditions. Another really important exception is that GINA does not apply to U.S. military members or employers with fewer than 15 employees. This doesn't mean that you wouldn't be able to get in the military or you would be kicked out of the military based on your genetic information. This also doesn't mean that if you work for an employer with fewer people that you could be fired based on your genetic information. It just means that there are no protections in place from preventing this from happening. Okay, so for those people who do decide to have genetic testing, there are 3 different genetic test results that you can get. The first is a positive result. This means a variant was found that is associated with ALSP. So this means there is a very good likelihood that you are going to develop ALSP in your future. This also means that your children have a 50% chance of inheriting the CSF1R variant as well, and may also go on to develop ALSP. This also means that you may be eligible for research studies, and including clinical trials. The second result is a negative result. This means a genetic variant associated with ALSP was not found. Our genetic testing methodologies are pretty good now. So if you get a negative result, we're pretty confident that that is a true result, but we can never say with 100% accuracy that you're never going to develop ALSP. And importantly, if you are negative for this testing, it means that you cannot pass this on to your children. So if you do not have a CSF1R variant associated with ALSP, you can't pass it on to your children. ALSP does not skip generations. The third result that you can get is called a variant of uncertain significance, or a VUS for short. This is when a genetic variant was found, but it is unclear whether it is actually whether it actually causes ALSP. Okay, these results can be really frustrating because we at this point in time, we just don't know if this variant is truly associated with ALSP or if it's a benign variant. And we all have many thousands of benign variants that are not associated with a disease, and it just makes us unique. And so for these VUSs, we just don't have enough evidence yet to know. And there may be additional steps that you can take to try to clarify what these VUSs mean. And this could be additional clinical information. This could be family testing as well. For example, if there's a large family where there are multiple people with ALSP and have this variant, that would make us think that this variant is truly associated with ALSP. However, if you have multiple family members who are, in their late 80s and have this variant, that would make us think that the variant is not associated with ALSP. One other thing is we do recommend that you don't take any medical actions based on a VUS result. Many labs or fertility clinics will not perform preimplantation genetic diagnosis based on a VUS result. Also, most clinical trials do not enroll people with a VUS. However, there are some exceptions. I have worked with some clinical trials that did accept individuals with a VUS. Okay, so we can move on to the next slide. And this is family testing and communication. All right, so if you have learned that you tested positive for the CSF1R gene, you have a variant associated with ALSP, you may need some time to digest that information and get comfortable with it and better understand what that means for you before you go and share that with information. However, we do strongly encourage you to talk about talk with your family members about their risk for developing ALSP so that they can make the right decision for themselves about whether they should test or not. This communication can be really difficult. And so genetic counselors can definitely help communicate with your family members. They can be a part of the genetic counseling appointment with you. The genetic counselors can also create a family letter that you can share with your family members. This is often used whenever a family member lives, a ways away, or maybe you're not in close contact with this family members, and you can send a letter as opposed to talking to them in person. And then finally, we were already talking about this somewhat, family member testing can help resolve those uncertain genetic test results sometimes. And that is my last slide. So I'm going to pass it over to Cynthia Cassandro.
Great. Thank you so much, Ashley. And also a huge thanks to Heidi and Erin and the Sisters Hope Foundation for the opportunity to provide an overview of Vigil Neuroscience's ALSP Aware genetic testing program. As Heidi said, my name is Cynthia Cassandro, and I am the Vice President of Patient Advocacy at Vigil Neuroscience. You can go to the next slide. So ALSP Aware is a no-cost genetic testing and counseling program to help identify the CSF1R variant. And this program was created in response to feedback from the community, both families and healthcare providers, in that access to timely and affordable testing and counseling was a barrier for those seeking these services. So Vigil partnered with Informed DNA and Prevention Genetics, and we launched ALSP Aware just about a year ago. And since that time, many individuals and healthcare providers have utilized the program for both the counseling and testing services. And we do continue to hear positive feedback about people's experience with the program. There are two components to the program. There's a single gene test for the CSF1R variant, and then there's a panel test, and I'll explain a little bit more about those. Important to note that this is a confidential genetic counseling and testing program, and the results are not known to Vigil. They're only known to the healthcare provider and the individual, and obviously genetic counselors. So if you are interested in the single gene test, to be eligible for this part of the program, you have to be 18 years or older, living in the United States, and have a family history of ALSP. The other option is to have a panel test, and the panel tests are ordered by your healthcare provider, and there are 24 genes in this panel, which obviously also include CSF1R. If you could go to the next slide. So if you choose to get tested through ALSP Aware, I'm just going to outline a little bit of the details around what to expect in a genetic counseling appointment with Informed DNA. Jill and Ashley have already provided a lot of great information around genetic testing and genetic counseling specific to the ALSP Aware program. Basically, it's exactly as they described. It's the information and support for you as an individual or with your healthcare provider are really critical in helping to ease the process of genetic testing. And the counselors at Informed DNA who work with the participants in this program are highly trained in hereditary neurological conditions, including ALSP. So if you choose ALSP Aware, you will receive initial or pre and post-test genetic counseling. And at the initial appointment, before you are tested or choose to be tested, the counselor will collect information about your medical and family history, discuss the genetic factors that cause ALSP, and review the benefits and limitations of genetic testing. All of the things that Jill and Ashley described in great detail. And if you do decide to proceed with the testing, the genetic counselors will coordinate the test order, and they'll arrange for the collection kit to be sent to you. And this particular type of test that is run through Prevention Genetics is a cheek swab. And then the results will be available to you through the genetic counselor approximately 1 month from the time when the lab receives the sample back from you. And then once the results are back at the post-test appointment, the genetic counselor will review the test results, the implications for you and your family, and provide you with a written summary and discussion of a copy of the genetic test results. And if you're interested in using the ALSP Aware program, you can schedule an appointment with the online registration tool, which is alspaware.com, or calling the 800 number that you see here and speak directly with a coordinator. And with that, I'd like to thank everybody once again and turn the program back over to Heidi.
Thank you, Cynthia. Now we're going to answer some questions that were submitted by our community. The first question is, my doctor told me my variant is sporadic or de novo. Does this mean that I'm the only family member that is affected and no one else is at risk or needs to be tested? Jillian, would you please answer this question?
Sure. Yeah, thank you, Heidi. So this is a common question. If you have a sporadic variant, then this means that you did not inherit the variant from either of your parents. And it's likely that we had already tested your parents to confirm whether or not this was an inherited or sporadic or random variant. So if the variant was present in either of your parents, then it's more likely the case that it was inherited from that parent. However, if your parents test negative for that variant, it's likely that this was a sporadic or random variant specific to you. So other family members in your generation and above, so your brothers, sisters, cousins, they would all return to general population risk for ALSP. So the chances of testing positive are never zero. But they can still choose to schedule an appointment with a genetic counselor if they are concerned or want testing. They may just need to pay out of pocket for this testing. Importantly, if you have a sporadic variant, then this is not the case for your children, and your children would still have a 50-50 chance of testing positive or inheriting the variant from you. So we would recommend genetic counseling and testing if you do have children.
Thank you, Jill. The next question, my spouse has ALSP. How do we tell our children about their genetic risk? Ashley, could you answer this question for us?
Yes, sure. First, I would like to say that there isn't a right or a wrong way to talk to your children about this. The conversation is unique to your situation and really depends on the age of your child. If your child is an adult, they can attend that genetic counseling appointment with you, and the genetic counselor can facilitate that conversation. The genetic counselor can also give you suggestions if your child is not a part of the appointment. And as I said before, some people need to digest the genetic test results before talking with family, while others need their family to cope and process this information. Some people think the conversation needs to be this big, sit down, but it could also come up naturally in conversation. For example, your child is present when your spouse has a symptom of ALSP, like a Parkinsonism or a speech disturbance. And you could point out that symptom and say, you went to see a doctor about that, and we have some news to share with you. For young children, we recommend age-appropriate information that is given over time. So the major takeaway here is that there isn't a right or wrong way to do it, and it really depends on your specific situation.
And Ashley, there's another question for you. Why is it uncommon to test children under the age of 18?
Great question. As parents, we often want to know everything about our children. What medical conditions do they have, or will they develop in the future? However, for adult onset conditions like ALSP, the genetic professional societies recommend waiting until the child is an adult so that they can make an informed decision that is right for them.
Thank you, Ashley. The next question. I've heard there are many possible options for getting genetic testing. What are the options, and how do I determine which option is right for me? Jillian, would you please take this question?
Sure. Yeah. So if someone in your family has a known CSF1R variant and you have access to their genetic testing report, then targeted testing of that specific variant may be the best option. However, if you don't have access to the family member's report, but you know that they do have ALSP, then testing the entire CSF1R gene might be the right option. And this involves sequencing of the gene, looking to see if there's any spelling errors or deletions or duplications that could have caused this disruption. Additionally, if you have a family history of multiple neurologic conditions, in this scenario, testing for a panel of genes may be the better option. So, multiple different genes that are all associated with different neurological conditions, including CSF1R. And we strongly recommend getting tested with a trusted genetic expert like a genetic counselor, and they can help guide this decision-making process, answer any questions, and identify the test option that's right for you. And of note, your risk for ALSP is not available through direct-to-consumer tests like 23andMe.
Thank you. I want to pursue genetic testing, but my neurologist doesn't think it's the right time for me. What are my options? Ashley, would you help us with this question?
Sure. So I don't know what the exact conversation was that you had with your neurologist. Maybe they thought you currently had a lot on your plate and it just wasn't the right time for testing. But ultimately, the decision to have genetic testing is up to you. You do not have to get testing through your neurologist. There are genetic experts like genetic counselors that can facilitate testing like those with the ALSP Aware program.
And the final question, Ashley, I'm going to have you answer as well. I was tested and my results came back as a variant of uncertain significance. What should I do now?
Yeah, these little tricky VUSs come up again. Yes. So sometimes the lab needs additional information like clinical notes or family testing to make a decision about a variant. Some labs offer free family member testing and others require payment. A genetic counselor can help walk you through this. Unfortunately, we are not always able to provide enough evidence to resolve a VUS. Sometimes we have to wait for other family members or other families with this variant to get testing, or for scientific studies to be performed to better understand how this variant works or does not work. Also, the lab should contact you or the ordering provider if the VUS is reclassified to either benign or disease-causing in the future. And I always recommend people that have had a VUS result to call their genetic counselor every year to see if there is an update on their VUS result.
That's definitely good information to know. Thanks, Ashley. Well, this concludes our webinar for today. I would like to thank you for joining us for this important conversation about genetic testing. A special thank you to Aaron, Ashley, Jill, Cynthia, and the support from Vigil Neuroscience. Have a great day.